Well, prostate cancer screening has been one of the most controversial things in the world of urology and really in cancer management and screening for a long time now. The U.S. Preventative Services Task Force seems to make recommendations every few years that stir up a lot of controversies, and we're fairly excited that over the past few years we have seen some positive changes in the guideline recommendation, and really to simplify that, 2012 they made a grade D recommendations where they said the harms of screening with the PSA test and the rectal exam outweigh the benefits. So they essentially recommended not screening for prostate cancer. Recently, they changed those recommendations, giving it a grade C recommendation, which you can take to mean see your doctor, talk about personalized screening recommendations, talk to your doctor about the risk of benefits. So I personally look at that in two ways. You know, the guidelines talk about benefits. When you look at the data, are strongest for men between 55 and 69. Some of the criticisms of the guidelines are that they seem to forget men who are younger. There don't seem to be very strong discussions for two very important patient groups, African American men and men with a family history, and they also seem to dissuade screening for men after the age of 70. And one of the criticisms there are you could have very fit men like Jamin will be when he is 70 years because he's so fit and exercises so vigorously, and he can probably run marathons when he's 80 years old, versus someone who may be very not healthy and very ill, where the benefits of screening may not be great for them because their life expectancy is less than 10 to 15 years. I personally look at the benefits of that early in your life PSA. By that I mean in your 40s. So there are a lot of studies that show that first PSA in your mid to early 40s is very predictive of your future risk of prostate cancer. There's a great study that was done looking at a population of men in Malmö, Sweden, where they got a PSA early in their life. This was a population-based study. They looked at people in the course of their lifetime, and they went back and looked at blood that was kept through the course of their life. Those early PSAs, specifically in the 40 to 49 year age bracket, they found that if your PSA was low, meaning that less than 1, your lifetime risk of prostate cancer was incredibly low. That prostate cancer that was going to kill you. If your PSA was above 1 and you didn't have and you didn't have risk factors for prostate cancer, African American, family history, but it was still above 1, you should probably be screened a bit more stringently because your risk of prostate cancer was increased. So that gives us some information that if you had a higher PSA in those ages, if you're African American, if you have family history, you should probably be on a different screening protocol than if you had a very low PSA, less than 1 at 45, if you weren't African American, or if you didn't have a family history of prostate cancer. So based on this, you can have a very good idea of how you should screen for the rest of your life. Honestly, for me, I would tell my brother that sometime in his early 40s, between 40 and 45, he should have a discussion with his doctor, and I would probably have him have that discussion not with me or my dad, because he would probably not listen to what we had to say because we're his family and he doesn't listen to anything we say anyway. But someone that he has objective relationship with, but he trusts, to discuss when he should do a screening PSA and a rectal exam. And it should be sometime in his early 40s. If he has a family history of prostate cancer, or if he's African American, he should probably do it earlier in his 40s, and that should give him a nice idea of how he can create a personalized prostate cancer screening protocol for the rest of his life. First thing is to get screened. Go and talk to your doctor about doing a prostate cancer screening, including a PSA test, which is a lab test. It's a simple lab test, and get a digital rectal exam. That not only gives you some idea of what your prostate cancer risk may be, but it also opens the door for seeing a doctor. That is a wonderful thing to do because it can check a lot of different things that, especially around your 40s, we seem to begin to enter the healthcare screening pathway of blood pressure, diabetes. You want to make sure that you're healthy in a number of different capacities. Fortunately, unless you have a history of colon cancer or blood in your stool, you may be about 10 years from a colon cancer screening, but you can talk to your doctor about a whole slew of other medical issues that you either need to do or you should be on the pathway of watching out, because you could potentially become a healthier person and maintain a healthy lifestyle. You could become very engaged in your own health.
Number two?
Number two, I would think about maintaining an idea of how to be more healthy in general. Make sure you're hydrating. Diets that are high in fruits and grains and vegetables, low in animal fats and red meats. Study after study shows that just in terms of general health from a cardiovascular standpoint, but also in terms of cancer risks, diets that are high in fruits and grains and vegetables and are low in red meats and fats have shown benefit, not just in terms of prostate cancer, but cancers in general. And in doing so, you improve your cardiovascular health, and that's a good thing to keep you as a young man or an older man healthy in general. And the third thing is just make sure that you maintain a healthy lifestyle in general, which includes not being sedentary, making sure that you're active, making sure that you try to decrease the stress in your life. And those things can really help maintain a healthier lifestyle, because unfortunately there's not a ton of things you can do that science has found that if you do this, you decrease your risk of having prostate cancer in general. And be mindful of your family risk, your risk factors for prostate cancer, which include family history, like we've talked about, being African American, and those populations have to really be mindful of going and seeing your doctor and getting screened for prostate cancer, which unfortunately includes a rectal exam. Although the controversies that exist around that, sometimes people say not doing that, but that really helps everything. So a PSA test and a rectal exam starting in your 40s is my personal opinion of how you can avoid missing a cancer that could potentially kill you, and reassure you that nothing's going on if it's not. My name is Dr. Ali Kasraeian, and it's time to drive for men's health.